Hey guys, how's it going? My name is Dr. Ali Dabaja. I'm a local ER physician and critical care physician in the Dearborn area. TCD has asked me to come on and update you on the corona crisis and what to do in the event that you get sick, treatment options, things like hospital resources, and also preventing the spread. So before we get started, let's talk about something extremely important. Two things: quarantine and social distancing and isolation. The important thing in this community, since we are so close, is to make sure we follow the advice of the health authorities when it comes to things of this nature, because it will decrease the spread and it will help people overcome this illness. What does that mean? If you do get sick, if you have cold, fever, chills, nausea, vomiting, not feeling well, you need to stay home and self-quarantine. What does that mean? That means you have to make sure that if you stay at the house, that you stay away from other people in the home, have your own bathroom, have your own, bedroom area, isolate yourself within your home just to protect your loved ones and people that might have chronic illnesses or are elderly or are vulnerable to get this disease and actually get sick. The second thing is practicing social distancing. Why is this important? I'm going to talk a little bit about that. That means is decreasing the amount of contact time you have with places where there are people, where there's congregations, where there are hangouts, etc. And that way we can decrease the spread of this illness. Why does that matter? When you look at our experiences in overseas countries, the doubling rate, which happens at an exponential rate at times if the infection is not controlled and these quarantine and isolation measures are not put into effect, is pretty alarming. So as an example, the state of California right now has 700 confirmed cases. It's tending, and according to the rates in this country, it's doubling every 4 days. By the end of the month, that means that 700 cases can turn to over 40,000 cases, and that could overwhelm our hospital system and put a barrier in preventing and helping people that actually get sick. So listening and making sure that you follow the advice of isolation and quarantine is extremely important. Let's get to talk a little bit about the symptoms. So how does it happen? What is corona? It's a virus. When someone coughs, sneezes, those droplets go. You might inhale them. You might touch them. You might put them in your nasal cavity, etc., and that in your mouth, and that can cause the illness. Typically, there's a period in which you are not sick after you get exposed. Usually it's 4 to 7 days. The medium time is about 5 days. When you do get sick on that day, and that 5th day, usually it starts off with a fever and maybe a dry cough. Very mild symptoms, kind of like the common cold. Those symptoms progress, and most people have a self-limited illness, which means the vast majority of us will be fine. Probably over 99% of us will have very mild disease and will be okay. But those symptoms progress to things like body aches. Sometimes you'll lose your appetite. Sometimes you might have some nausea and vomiting. At day 6 or 7, some people actually get ill again, and that is because your lungs start to get affected and they're overwhelmed with inflammation and potentially pneumonia. So when you hear people talk about double pneumonia and corona, this is what we're talking about. So if you have a loved one that is sick and then gets better and you're quarantined, but then that individual starts getting short of breath, that is the moment in which you should be seeking more aggressive medical care through your primary care doctor and through our hospitals. So what happens if I do get it? We talked a little bit about self-quarantine. That's extremely important. Do not go out, guys, if you are sick. And if you have to go out, it has to be for essential purposes, such as going to see a doctor or going into the hospital. Okay? People are asking me a little bit about the fatality rate in coronavirus. Why is that important? I don't want to heighten, and make people worried, but I think it's very important to understand the vast majority of us that get ill will not pass away and we will not die. Who are the people at risk? We talked about people that have a higher fatality rate, i.e. they die if they get the virus, are those people that are more elderly, above 50 and 60, the people that have comorbid conditions, which are chronic illnesses, which are things like diabetes, which are things like hypertension, which are things like coronary artery disease or previous history of heart attacks, which are things like chronic lung disease and emphysema and COPD and a prolonged history of smoking, things like active cancer and chemotherapy, and to a lesser extent, things like immunocompromised states like hepatitis, HIV, chronic kidney disease, and potentially even stroke. So keep those things in mind. Those are the people that are at increased risk, and we as the vectors, we may be healthy, we may not get super sick. We are the ones making those people that are pretty vulnerable sick. So the fatality rate, going back to that, right now our experiences vary. It's anywhere between 0.5 to 3%. What does that actually mean? It's a fraction. So out of every, let's say, 100 people that may get sick with the corona, well, a fatality rate of 1% is 1 out of 100 may die. And because the numbers overseas were quite alarming initially. We think that number is going to decrease substantially once we start testing a lot of people. So in China, for instance, the mortality or the fatality rate was around 3.5%. In South Korea, it was less than 1%. And on cruise ships, on the cruise ships incidents, it was less than 0.6%. Those are all great numbers, and we want to see that go down. Keep that in mind. That means you are safe. Just keep others safe from you getting ill. So I want to talk a little bit about viral shedding. A lot of times people don't understand that even when they're not sick, they can get others sick. That's why isolation and quarantine is super important. Even when you may not even feel ill, you could be viral shedding, but it's very important to understand as you get better throughout the illness, the virus can still be at a large amount inside your body and infecting others. And typically, the highest state at which you're most infectious is at day 10 of your illness. So keep in mind, practicing safe quarantine techniques and staying away is extremely important. People are asking me a little bit about treatment. Right now, the best treatment options for people that are not sick is to stay home, is to hydrate yourself, is to take things like acetaminophen and Tylenol for pain, body aches, and that is it. There's a lot of novel therapies that are coming out, antivirals, that really don't have great data, and we will not have access to them. We're going to save those for the extremely ill and those that get admitted to the hospital. And so we talked a little bit about treatment. People are asking me a little bit about what happens in our hospital systems. Again, if we don't follow the advice of health authorities, we could be in a crisis. And that means that because we are not isolating ourselves, because we're not washing our hands, because we're not, protecting others from potentially our sickness and the sickness of others, we may have a crisis on our hands, meaning that amount of people that get sick and need to get hospitalized might exceed our resources. But I will tell you, I believe in my community, and also we do have a tremendous amount of resources here in Southeast Michigan. I know we will overcome this if we are able to work together. So guys, let's follow safe practices. Let's make sure we are not putting anyone at risk. Let's keep at home if we don't need to go out. Let's self-quarantine when we're needed. And also, let's not stress out or get anxious about the crisis. Stay calm. Have a plan in place for your family, for taking care of elderly people, and stay safe. Thank you so much. Thank you, TCD. Peace out, guys.